That's a long road you've been walking.
Most people who we treat have anxiety. I think most people in the world right now have anxiety. Many people who come here are so disconnected from their own experience, from their own body, from their own emotions. They don't really understand how anxious they are. And that's work we do really well here. That's one of my personal passions, because I've seen it, I've experienced it in my own life, being scared about tomorrow, being scared about the next moment, feeling like whatever's in it, I can't handle that. It's going to overtake me. I'm not going to know what to do. I'm going to do something wrong. I'm going to look stupid. I'm going to lose everything. That's an incredibly difficult, lonely, isolating place to be. So many people are in that place alone, believing this is just how it's supposed to be, feeling almost normalized to it. And when they come here, they realize they're not alone in that. So many other people are suffering with anxiety and depression also in some cases. And there's ways that you can cope with it. Relief, relief, relief is what clients feel here when they talk about what they're scared of. When they learn techniques that can be as simple as breathing or being in an environment like this and looking around them and seeing and hearing and touching things and saying it out loud. Just doing those simple things can change your entire experience. It's not about changing anything outside of them. It's about changing what's in here, how they look at the world, how they look at themselves, willingness to reach out, to ask for help, to say I'm scared, can change everything. And that's what we do here.
Crawl up here in my arms, child. Let me carry